the letter that was sent by the NHS actually doesn't direct anybody into any particular centre. It invites people to book either on the phone or via a web page into what we call the national booking system. And when you go when you receive your letter and you go on this website, the system prompts you to put your postcode and gives you the nearest 5, 10, 20 centres that offer the vaccination service, and then you pick the one that is most convenient to you. You don't have to come to Marlow. You might be staying with relatives in Oxfordshire and could certainly attend a service in Oxfordshire, even if you're a Marlow resident. So actually, there is no direction of patient into any particular service. That's very important to understand, because I've heard a lot of people asking me, do I have to come to you? Do I have to go somewhere else? No, you don't. It's your choice, but obviously you will need 2 doses of that vaccine. So the advice always is to pick a centre that you can attend twice, 12 weeks apart. So, it makes sense that people pick a service that is close to their home, but it doesn't have to be Marlow Globe Park.
Now, one of the things some people are saying, there's all sorts of stuff on the internet at the moment, that there is a shortage, Pfizer vaccine and the Oxford-Seneca one. So is there a shortage? Have you been able to get it okay?
Yes, so there is no such thing as a shortage, because the manufacturer actually produced a certain number of doses, and you will have heard in the news that the government has purchased X million of doses of both the Pfizer and the AstraZeneca vaccine. But the MHRA, which is the body that regulate and authorize drugs into this country, have to approve every single batch of the vaccine. And there is a slight delay in that. And should a batch fail inspections, then it wouldn't be authorized to be marketed. So initially, there's been a few teething problems, which meant that perhaps not as many vaccines expected have been trickled through the centres. But we've been told that there are many more good batch on the market now, that the supply is very fair, and that all centres will receive sufficient vaccines to be able to vaccinate the ambitious target of 2 million people per week as set by the government. And we hope that we can play a part in that, in supporting the other providers locally to achieve that target.
Now, have you been seeking people to actually help you do that? People who are trained to do vaccination? Has that been part of your process?
Yes, indeed. So it was a very tall and ambitious task that we were given, because, as you know, I own the pharmacy in Lane, and in fact, I own a couple of other pharmacies in Berkshire. But the pharmacies that I have are perhaps not suitable to put the vaccination service inside the pharmacy, because the whole pharmacy operation would grind to a halt, and we've got to continue dispensing prescription, giving advice, and helping patients generally. We even continue to do flu jabs in the pharmacy, and that obviously couldn't stop. Equally, I couldn't pull out all my staff of the pharmacies and put them in the vaccination centre, because for the same reason, the pharmacies would have been understaffed. So the decision was taken to speak to colleagues, pharmacists initially, but any healthcare professional, and also I put a call out to the general population through Facebook to try and recruit some volunteers that could help us for a number of tasks, anything from marshalling in the car park outside to make sure that that works well, to queue control, because we expect that some of the local resident who, as you rightly said earlier, anxious to get going, might come in early for the vaccination, and we don't really need long queues. But we also needed support with data entry, and obviously to administer the vaccine. So the population has been amazing. I mean, I've been on record a couple of times to say how overwhelming the response from the community was in terms of volunteers and vaccinators. And even today, I still have people saying, I've done the training for vaccination, I'd like to come and support your centre. And it's really, really heartwarming to see so many people coming together, complete strangers, coming together to try and make this happen. And I have to say, I've got to give a big shout to 4 or 5 what I call super volunteers who have dedicated a lot of time recently to call those hundreds of volunteers that have come forward to try and put training courses together quickly so we can explain the process and to coordinate and book people in so we have the right number of people to be able to support the vaccination program. I have to say, Marlow has really shone really well throughout, and the support I've received is absolutely outstanding.
That is lovely to know, and I'd be very happy to interview any of the people that have led the way in this, because I want to spread the word. Because like lots of people, when I was trying to do the research last week, I just couldn't track down who to talk to, where the centres were going to be. At one point, some people were saying it was going to be at Port Gardens, but clearly you were looking for the right place. Why did you select Globe Park? And what have you had to do to the location to make it right for vaccination?
So we put a call out, and in my mind, I wanted somewhere accessible, with plenty of parking, somewhere that was both professional, well ventilated, and had plenty of space. Because if you think about the logistic of the vaccination, we'll have people coming in. People waiting for the vaccination, so we needed some sort of waiting area. We will have people getting vaccinated, so we needed vaccination booths, offices, or something like this. And then we needed a quite large post-vaccination area, as a lot of the people will be asked to stay for up to 15 minutes after the vaccination, should they start feeling unwell immediately after the vaccine, or have an allergic reaction to actually what is quite an unknown vaccine. And although we know it's very well tolerated, everyone's individual. So that sort of restricted a little bit what I could go for. But we were very fortunate that we have many offices currently that are not really being used fully, primarily because they are people are working remotely. And Softcat that we know put their hands up and said, we'd like to help. We don't use our offices. We think what we have would be suitable. And when we visited the site, we also felt that it was really suitable. And I think when people come to the site, they will be really impressed. The location, as I just said, is in the Softcat offices, and it's in the Luna House, and we are currently in the process of signposting the site so people know where to go. But I'd like to make a very important point at this stage, if I may. Over the last 24 hours, I've had people ringing Lane End Pharmacy asking to make an appointment. I've also had people ringing Softcat trying to make an appointment. And I want to make it clear to everyone that we are not in a position to make appointment for patient. The patient that booked with us can only be booked through the national booking system once they have received a letter. So some people may have heard yesterday that the group of 70 plus are now being invited to receive the vaccination. I don't know whether it applies to the area here, because we're only starting to vaccinate the 80-year-old and over last week and this week. So please wait to receive your letter. There's no need to contact us. There's no need to come to Globe Park. We cannot accommodate walking patients. We don't hold patient records. Therefore, unless they've been booked in through the national booking system, we're not able to see them. So it's important that people understand that calling us is not going to either speed the process or help in any way. I think patients have to be patient, and they have to wait for a letter from the national booking system, or alternatively they may also be contacted by their GP, and that will be perfectly acceptable, because we know that the local GP are also providing a service, and working together we hope that we can vaccinate as many people as quickly as possible.